Hello, my name is Lori Powers, and I want to thank you all for listening to my presentation today. My presentation is on Sentinel events. It is my hopes that after this presentation you will have a better understanding of what a Sentinel event is and what constitutes a Sentinel event. And with that said, let's go ahead and get started. Well, first, the definition of a Sentinel event is an event that is unexpected and or unanticipated, which has an outcome of death or serious physical or physiological injury or risk. Now, some examples of a Sentinel event is loss of limb or function, patient on suicide watch commits suicide anyway, an unexpected death of full-term infant, an infant abduction, infant is discharged to the wrong family, rape, reaction to mismatched blood, and surgery on the wrong patient or the wrong body part. Now, 44,000 to 98,000 Americans die each year from medical errors. Now, there was a study done that shows this number, and most of these are preventable. The most common medical errors, well, first let's cover this. What's a medical error? No, it's an incorrect administration of drugs, an unreadable drug order, incorrect combination or formulation of drugs for a given condition, unknown allergies to drugs, drugs not given at the right time. And these are the most common that I have listed here. And due to time constraints, I'm not going to go over those. But you can see all of these are easily preventable. If more detail in the medical record, double checking and triple checking. If there's a question, don't just do it, get an answer. Now, a Sentinel event. Well, that's an unexpected occurrence involving death or serious physical or physiological injury, like I said before. And here again is the examples. Now, 1,900 Sentinel events reviewed by the Joint Commission since January of 1995 shows that patient suicides account for 16.5% of Sentinel events. Operative and post-operative complications are 12.3%. Wrong surgery sites, 11.7%. And medication errors are 11.5%. I'm pretty sure some of these, they go under medical error because they are preventable. So they would not be considered a Sentinel event, such as a medication error. Even a wrong site surgery. This should be a medical error, in my opinion, because it's preventable. Now, there are 4 goals to the Joint Commission Sentinel event policy. Now, I took these directly from the Joint Commission's website, and so I'll just quickly go over these again, because due to time constraints, I can't go through all of it. The first one is to have a positive impact on improving patient care, treatment, services, and preventing Sentinel events. Focusing on the attention of a disease-specific care program that has already had a Sentinel event, understanding what the contributing factors are to an event, disease-specific care program systems, increase the general knowledge about Sentinel events and what contributes to those factors and the strategies to prevent them. Maintain the confidence of the public and certify programs in the certification process. Now that's crucial because they could lose their certification. Now, what are the expectations for organizations? Well, a certified facility should classify and respond properly to all Sentinel events happening in their facility, or any event that's related to services that facility offers. Now, how do they respond to a Sentinel event? Well, first off, it's the root cause analysis. Now, that's a process to identify basic or casual factors that is a factor to causing this. And then there's the action plan, which is to identify strategies to implement reduced risk of Sentinel events. And then there's the survey process, and that's evaluating the facility's compliance with applicable standards, and then they're scored on all of these processes. Now, when a Sentinel event is identified, the person doing the survey has to report, and these are the reporting steps that they must take. First, they have to inform the CEO that an event has been identified. They also have to let that CEO know that this event has to be reported to the Joint Commission for review and follow-up. And then, once that's done, they have to review the organization's process for responding to a Sentinel event, then interview the organization's leaders and staff about their expectations and responsibilities for identifying, reporting, and responding to Sentinel events. Then they can ask for examples of the root cause analysis that has been conducted in the past year to assess if the organization's process is adequate for responding to an event. When they ask for examples, they can include closed cases or a near-miss case. Now, in summary, I'm just going to do a quick overview because there is a lot of information here, and there's not even half of what I had in here. I had to do some serious editing here. Okay, so a Sentinel event is an unexpected, or what did I say? An anticipated event, such as death, or it can go into death. It's physical or physiological injury or risk, loss of limb or function, suicide, rape, infant death, infant discharge to wrong patient or to wrong parent, surgery was done on the wrong patient or the wrong body part, mismatched blood transfusions. The policy is they need to are trying to improve patient care, treatment, services, preventing Sentinel events, focusing on disease-specific care, and increasing the knowledge of what a Sentinel event is and how to prevent them, and if one happens, how to respond to it quickly. In reporting, they have to classify and respond to Sentinel events. They have to do a root cause analysis, an action plan, and implement improvements if an event has been identified. And medical errors. Now, these are incorrect administration of medication. Dosage or route is wrong. Failure to prescribe or administer the correct drug. Use of outdated drugs. Failure to observe the correct time when the drug needs to be given. They don't know if the patient has an allergy. They can't read the handwritten orders, or they gave them the wrong medication, or maybe it's the same medication, just a different manufacturer. That different drugs, I'm not really sure what that is, other than it's not good. I couldn't find the information on that. It didn't really tell me. And then, of course, like I said, drug allergies. There was so much information here I wanted to try and put in, but I didn't have the time. I want to thank you for listening to my presentation. And if you want to know more, I would suggest going to the Joint Commission's website. There was a lot of information there that I wanted to put in, but I'd be here 20 minutes at least. Anyway, thank you, and you guys have a good evening.